Okay guys, my name is Dr. Khan. We'll be dealing with this new topic which is called as conjunctiva. Come on guys, conjunctiva you might have heard, conjunctiva you might have heard about conjunctivitis and all, right? Inflammation of the conjunctiva is conjunctivitis. But what is this conjunctiva? Where is this conjunctiva? Conjunctiva is a transparent layer that covers the white part of the eye except for the cornea. Conjunctiva is a transparent layer that covers the sclera except the cornea. Cornea is not covered by conjunctiva. If cornea would have a conjunctiva, then what will happen? Then our eyesight will be low. Why? Because conjunctiva will decrease the vision. So remember guys, conjunctiva is a transparent layer that covers the eyeball, right? There are three forms of conjunctiva. One is called as palpebral conjunctiva, other is called as bulbar conjunctiva, and last is called as fornicial conjunctiva. Palpebral conjunctiva meaning what? Palpebral conjunctiva is seen when you evert the eyelid. When you evert the eyelid, the conjunctiva that you see is called as palpebral conjunctiva. On the white part of the eye, on the white part of the eyeball, yani on the sclera, the conjunctiva that you see is called as bulbar conjunctiva. And on the angles of the eye, the conjunctiva that is that's present is called as fornicial conjunctiva. That is called as what guys? Fornicial conjunctiva. And this conjunctiva, it is what guys? It is stratified non-keratinized. It is made up of stratified non-keratinized epithelium. Stratified non-keratinized squamous epithelium. So this conjunctiva, I will repeat from here, this conjunctiva is made up of stratified non-keratinized squamous epithelium, right? So inflammation of this conjunctiva is called as conjunctivitis. It can be, there are many types of conjunctivitis: true membranous conjunctivitis, pseudo-membranous conjunctivitis, angular conjunctivitis, swimming pool conjunctivitis. There are many other forms of conjunctivitis, but remember, conjunctiva is a transparent layer of film that covers the most part of the eyeball except for the cornea, right? So conjunctiva is a transparent layer that covers the entire eyeball except for the cornea. There are three types of conjunctiva, which is called as bulbar, palpebral and fornicial conjunctiva. The epithelial lining of the conjunctiva is what guys? It is stratified non-keratinized squamous epithelium. Non-keratinized squamous epithelium. So conjunctiva is usually bare and it just finishes off at the limbus. You know what is limbus? Limbus is the place where the sclera and the cornea meet. That is called as limbus, right? Now guys, in front of the cornea, there is a thin layer of tear film. Okay, even though we are discussing conjunctiva, we have to discuss something about called as tear film. Just in front of the cornea, there is a thin layer of film which is called as tear film. This tear film is made up of three layers. Right? So guys, remember, we are starting with this thing which is called as tear film. Tear film is a thin layer of film that covers the conjunctiva as well as cornea. A thin layer of film that covers the conjunctiva as well as cornea. This tear film is made up of three layers. What three layers? I used to remember tear film is made up of three layers. The first layer is called as the lipid layer. The second layer is called as the aqueous layer. And the third layer is called as a mucin layer. The first layer is formed by the meibomian glands. Lipid layer is formed by the meibomian glands. Second is the aqueous layer, which is formed by the lacrimal gland. What is the function of aqueous layer? The aqueous layer provides glucose, provides oxygen to the eye. Third layer is the mucin. Mucin layer is formed by goblet cells of the eye. The function of goblet cell is to hold the tear film. Now guys, remember, I am having tear in my eyes. I am having a bit of tear in my eye. But when I look down, is the tear falling? No. Why does the tear doesn't fall? Why? Because the goblet cell produces mucin and the function of this mucin layer is to stabilize the tear inside the eye. So we are talking about tear film. The goblet cells are here for the production of mucin. I told you tear film is formed by 3 layers. The lipid, aqueous and the mucin layer, right? So tear film, lipid, aqueous and the mucin layer. The lipid layer, guys, lipid layer. The lipid layer is formed by the upper and the lower eyelid glands, which is called as meibomian glands. Second is the aqueous layer. The aqueous layer is formed by the lacrimal gland. And what is the function of the aqueous layer? It is the most important layer of the eye, guys. It provides oxygen, glucose, carbon dioxide. Basically, it is the thing that is providing nutrition to the eye. I'm not talking about aqueous humor, guys. I'm talking about this tear film aqueous layer. It provides oxygen, glucose, carbon dioxide, electrolytes, lysozyme to the eye that prevents any infection also, right? There is a condition called as crocodile tears. Crocodile tears meaning what? Crocodile tears means patient will be having just tearing from the eye, even though there is no emotional thing, but still the patient is having tearing of the eye. That is called as crocodile tears. Crocodile tears are seen due to inappropriate stimulation of the lacrimal glands. Okay? Due to inappropriate stimulation of the lacrimal glands and misdirection of the nerves, the patient will have crocodile tears. So once again, guys, 3 layers of the tear film is lipid layer, aqueous layer. Lipid layer is formed by meibomian glands. Aqueous layer is formed by lacrimal glands. And mucin layer is formed by what cells? Goblet cell. What is the function of this mucin layer? The function of mucin layer is to stabilize the tear. Is to stabilize the tear inside the eye. Stabilize the tear inside the eye. This is the tear film, guys. Okay? It has lipid layer, aqueous layer and mucin layer. Lipid, aqueous and mucin layer, right? So guys, remember, if this any one of the 3 layers is absent, if lipid, aqueous or mucin is absent, it leads to a condition called as dry eyes. It leads to a condition called as what, guys? Dry eyes. There is dry eyes seen due to deficiency of any of these 3 layers, or sometimes there might be other underlying cause that can cause dry eyes, such as presence of Sjogren's syndrome. If the patient is suffering with what syndrome, guys? Sjogren's syndrome, the patient might have what? Dry eyes, right? So remember, we are discussing about what? Absence of any of these 3 layers is called as dry eyes, which is called as keratoconjunctivitis sicca. Sjogren's syndrome, the 3 things are seen in Sjogren's syndrome: dry eyes, dry mouth and rheumatoid arthritis. Dry eyes, dry mouth and rheumatoid arthritis. This condition called as dry eyes is commonly seen in contact lens wearers, or it is commonly seen in patient who sits or in person who sits in front of the computer for more than 12 hours. For more than 12 hours. Why? Because when we sit in front of the computer for more than 12 hours or more than 8 to 10 hours, it is commonly seen in software engineers, guys. When we sit in the front of computer for more time, we are staring at the screen without blinking. When we are not blinking, our eyes will not get moistened up. When we blink, the eyes will be moistened up and all, right? So dry eyes are commonly seen in the patients who are sitting in front of the computer, contact lens wearers who are wearing contact lenses for a long time, or after LASIK surgery also you might see dry eyes. So I told you, absence of any of these 3 layers can lead to dry eyes. In these 3 layers, which layer deficiency is common? If that is the question, your answer is what? Mucin layer deficiency is common. Which layer deficiency is rare? Lipid layer deficiency is very rarely seen. And why do you see this mucin layer deficiency? Why? Because mucin layer deficiency is commonly seen due to vitamin A deficiency. Due to vitamin A deficiency. This vitamin A deficiency causes destruction of the goblet cells, leading to what? Leading to mucin deficiency. Right? So remember, guys, under 3 layers, the most commonly seen, the most common layer deficiency that you see is what, guys? It is a mucin layer. And the least is what? It is the lipid layer. It is a lipid layer. So guys, remember the first clinical sign, so under the layer deficiency, lipid, aqueous and mucin we have discussed. Okay? The first clinical sign of vitamin A deficiency First clinical sign of vitamin A deficiency is conjunctival xerosis. Conjunctival xerosis, right? And dry eyes which are caused due to vitamin A deficiency is called as xerophthalmia. Dry eyes caused by vitamin A deficiency is called as, so dry eyes, remember the first clinical sign of vitamin A deficiency is what? The first clinical sign of vitamin A deficiency is conjunctival xerosis. Conjunctival xerosis, right? That is the clinical sign of vitamin A deficiency. But the symptom of vitamin A deficiency is nyctalopia. And on examination, you might see a whitish foamy deposit on the conjunctiva, which is called as Bitot spot. We are discussing a few things about vitamin A deficiency, guys. Vitamin A deficiency. Dry eyes can be caused due to many reasons, but dry eyes caused by vitamin A deficiency is called as xerophthalmia. We are discussing some of few points of xerophthalmia. The patient will have nyctalopia. The patient will have Bitot spots developing on the conjunctiva, right? So dry eyes caused by vitamin A deficiency is called as xerophthalmia. The first sign of vitamin A deficiency is conjunctival xerosis. Now guys, there is a condition called as keratomalacia, basically melting of the cornea. That is a very dangerous condition. It's called as keratomalacia. It can be seen due to vitamin A deficiency. It can be seen due to post-measles infection. Post-measles infection or due to chemical injuries. It is the most dangerous condition, guys. Melting of the cornea. Why? Because you guys know cornea is responsible for how many diopters of the eye? 47 diopters. Total power of the eye is 60 diopters. If 47 diopters are gone, patient is nearly blind. Patient is nearly blind. So the next condition that we are discussing is keratomalacia. Melting of the cornea is called as keratomalacia. Keratomalacia is what, guys? You can see in this picture. Melting of cornea is called as keratomalacia, which is a very dangerous condition which can be seen due to vitamin A deficiency and post-measles infection, right? And I also told you that this keratomalacia can also be seen due to chemical injuries of the eye or SJS. What is SJS? Stevens-Johnson syndrome. Stevens-Johnson syndrome, right? Next coming to the thing which is called as chemical injuries of the eye. Now regarding chemical injuries, I told you a small thing, guys, that in ophthal there is no emergencies except for angle closure glaucoma, CRAO and chemical injuries. In chemical injuries, there might be two chemical injuries. One chemical injury that you commonly see, okay? It is basically a cowardly act, guys. A covered person. Covered means not covered. It is COWARD. A covered person, he throws acid on a lady. The patient, when the patient is thrown acid, what will happen? That sulfuric acid can damage the cornea, right? Chemical injuries of the eye, they are of two types. One that is due to the acid, that is called as acid injury. Other is called as an alkali injury. Which is more dangerous? Which sounds more dangerous? Acid injury. But acid injury is not that dangerous, guys. The most dangerous injury is the alkali injury. Alkali injury, right? So remember, guys, we are discussing about what? We are discussing about the chemical injuries of the eye. In chemical injuries, alkali such as ammonia or calcium hydroxide is the most dangerous. And acid can also, remember, in chemical injuries, there are two things that can cause injuries to the eye. There are two chemicals. One is the acid, other is the alkali. In alkali, it is the ammonia. In acid, it is the sulfuric acid, which causes liquefactive necrosis, which can lead to perforation of the cornea and the patient might become blind. Okay? So, but remember, it will take much time. By the time liquefactive necrosis occurs, it will take much time for it to develop, much time for the patient to develop the liquefactive necrosis of the cornea, right? So what happens as the patient is having any chemical injury of the eye such as acid injury, there is much time. After acid attack, there is much time by the patient. Right, we'll repeat it once again. We are discussing about the chemical injuries of the eye. Chemical injuries, there are two types of chemical that can cause injury to the eye. One is the acid, other is the alkali. Which is more dangerous? Acid means acid attack which is caused by some covered person who throws acid on the person. So that is dangerous, or alkali injury. If you go with the name and all, you will say what acid injury is dangerous, but acid is not that dangerous, guys. Acid injury will cause liquefactive necrosis, very, very, very slow, and you can easily prevent that necrosis and perforation. But alkali injury is very dangerous. Which alkali, guys? Ammonia or calcium hydroxide. That alkali can cause much damage to the cornea. Now guys, chemical injuries are more dangerous than mechanical injuries. Acid injury, I told you what acid? Sulfuric acid. There is a condition called as vitriolage. Vitriolage means what? Battery bust. It's a very, in the acid injury, that's a worst type of injury called as vitriolage. In vitriolage or battery bust, while opening the hot battery, if at all the battery water spills in the patient's eye, what will happen? It will basically damage the lacrimal glands and it will basically damage the goblet cells. If lacrimal glands are being damaged, there is no aqueous layer formed in the tear film. Okay? And second, what will happen? Initially, what happens, guys? Lacrimal glands are being damaged. Second, goblet cells are damaged. If at all some tear is being formed, if goblet cells are damaged, will there be any stability of the tear in the eye? No. Right? So remember, vitriolage is the worst condition. Just write there. Vitriolage is a very dangerous condition where there is damage to the lacrimal gland and goblet cells. Lacrimal glands and goblet cells. If lacrimal gland is damaged, there is no tears produced and there is no aqueous layer being formed. If goblet cells are damaged, no matter how much of tears are there in the eye, it will just roll down. Why? Because there is no stability. So basically, that is a very worst thing. So vitriolage, or it is also called as battery bust. So if at all any person is there who's having any chemical injury to the eye, the first thing or the best thing is what? Irrigate the eye with the water until you get a normal pH of the tears, which is 7.4, right? And then you reduce the inflammation by giving some steroids to the patient. Okay. So treatment is what? Wash the eye with water for at least 30 minutes and then check the pH value till you get a normal pH value of 7.4. Then you have to give steroids. That is regarding what, guys? That's regarding the chemical injury of the eye. Chemical injury of the eye. Dry eyes. We are discussing about dry eyes. Start from here. Dry eyes. Dry eyes is nothing but what? Absence of any of the three layers of the tear film is called as dry eyes. Lipid, aqueous or mucin, if there is absence, then it is called as dry eyes. In dry eyes, remember guys, dry eyes patient cannot sit in the sun, cannot sit in front of the sun, cannot sit in the AC room for a longer period of time. What is the complaint of the patient, guys? The patient complains of foreign body sensation, right? Patient complains of foreign body sensation. Patient complains of reddening of the eyes, and in the evening time it gets more worsen, right? So remember, these are the features of dry eyes. There is a thing called as computer vision syndrome or TV vision syndrome. When you sit in the front of TV or computer for more than 6 hours, what will happen to our blinking power of the eye? Our blinking power of the eye will reduce. So because remember guys, normally in 1 minute, how many times we should blink? We should blink at least 20 times in 1 minute. But when you are sitting in front of the computer, you blink 7 times per minute. Remember, how is blinking related to dry eyes? If I don't blink, how will I land up into dry eyes? Now guys, look over here. When I am sitting in front of the computer, staring the computer screen, what will happen to my eyes? I'm just not blinking, I'm just watching the computer. If I am not blinking, what will happen? First of all, you need to understand if you are blinking, what normally happens. Okay? So guys, remember, when you blink, the eyeball is coated with a tear film. But as you are opening the eyes, slowly the tear film spreads on the cornea, right? It is spreading. When you are opening, slowly it is spreading. As it is spreading and spreading, there will be a point where as you are spreading, what happens to the tear film? It becomes thin and thin. Okay? Thin and thin. As you are spreading, the tear film becomes thin and thin. There will be a point where what will happen? The tear will break. The tear will break. And at that time again you will blink. At that time again you will blink. This is called as tear breakup time. This is called as what, guys? Tear breakup time. The normal tear breakup time is 10 seconds. Once again, what we are discussing is, we are discussing about dry eyes. Okay? We are discussing about dry eyes. In dry eyes, I told you, when you are sitting in front of the computer, your blinking rate is reduced. As you are blinking or closing your eyes, your eyeball is coated with the tear film. As you are opening the eyes, this tear film gets spread on the eyeball. As you are opening the eyes, again it is spreading. At one point, what happens? The tear breakups, and again you will blink. So remember, that is called as the tear breakup time. The tear breakup time is normally 10 seconds. But when you are in front of the computer and all, this blinking rate decreases. That's why the patient will be at risk of developing what? Dry eyes. So what is the test done to detect dry eyes? What is the test done to detect dry eyes? What is the test that is done to detect dry eyes? The test that is done to detect dry eyes is called as Rose Bengal dye test, or it is also called as, the next test that, remember, the first test that is done is called as Rose Bengal dye test. The second test that is done is called as Schirmer's test. What is Rose Bengal dye test? Rose Bengal dye is nothing but what, guys? A pink color dye. You take a paper, pink color paper, and you place it into the patient's eye, and after some time remove the paper and see what happens to the eye. Normally, if you are having tears in your eye, the pink color, it gets absorbed into the tears and it will wash off. But if your eye is dry, the eye will take up the pink color. If your eye is dry, the eye will take up the pink color. So that is called as Rose Bengal dye test. Second is called as what, guys? Schirmer's test. Schirmer test means what? You take a Schirmer paper. There will be a paper called a Schirmer paper. You take the Schirmer paper and place 1/3 from the lateral side, 2/3 from the medial side into the eye and keep it for 10 seconds. And after 10 seconds, you have to check how much of the paper is getting wet with tears. How much of paper is getting wet with tears? If more than 10 mm of paper is getting wet with tears, that means the eye is totally normal. The tears are very good. There is no dry eyes. But less than 10 mm getting wet with tears, that means the patient is having dry eyes. The worst scenario is what? Having a Schirmer score of 0. Having a Schirmer score of 0. Right? So right there, guys. Rose Bengal dye test. In Rose Bengal dye test, what we do? In Rose Bengal dye test, what we do? We take pink color paper and place it in the eye. And then we remove it. If the eye is moist, there will be no color change. There will be no color change to the eye. But if dry eye, then the eye will take up the pink color. Then eye will take up the pink color. That is called as what, guys? That's called as what test? Rose Bengal dye test. Second test is what? The Strimmer's test. Second test is what, guys? Strimmer's test. Strimmer's test, what we do here, in Strimmer's test, what we do here, we place a shrimmer paper in the eye, 2/3 from the medial side. Here we place the shrimmer paper in the eye, 2/3 from the medial side and 1/3 from lateral side. And then we check how much of it's wet with tear. If it's more than 10 mm, if more than 10 mm of it, if more than 10 mm of it is wet, then the patient is having normal eyes. If less than 10 mm is wet, then it is dry eyes. The worst scenario is what? Having a Strimmer score of 0. Worst scenario is having a Strimmer score of 0. Having a Strimmer score of 0. So how will you manage this dry eyes, guys? The patient will be having foreign body sensation, redness of the eye. He can't sit in front of the computer or in the front of the sun and all. Okay. How will you manage this dry eyes? Management of the dry eyes is very simple. The patient is having absence of one layer of the tear film. Give him some artificial tears which are made up of what? Methyl cellulose. Okay? Give him lubricating drops which are made up of methyl cellulose. There is no definitive treatment, but lubricants can be given, which is artificial tears made up of what, guys? Methyl cellulose. This should be given throughout life. This should be given throughout life. But if you don't treat this dry eyes, then what will happen? Then the patient will have corneal ulcer. Repeated corneal ulcer could happen. And in severe condition, the cornea can melt off, leading to keratomalacia. I told you guys, worst scenario is what? Strimmer score of 0. Strimmer score of 0. That's the worst scenario of dry eyes. Okay. Now guys, I told you we are discussing about conjunctiva. Conjunctiva. I told you conjunctiva is a thin transparent layer that is usually covering the eyeball. It is covering the white portion of the eyeball. White portion is the sclera, right? It is finishing off at the limbus. There are 3 forms of conjunctiva: the bulbar conjunctiva, the forniceal conjunctiva, and the palpebral conjunctiva. Whenever anything enters the eye, our conjunctiva sends two soldiers to fight against those two things. Those things. Okay? Whenever any organism or anything enters the eye, conjunctiva will send 2 soldiers. Depending upon what is entering the eye, it will decide what soldier has to be sent. If it is chlamydia, if it is any bacteria, the soldier that is sent to fight against it, it is what? Follicles. It is follicles. If it is virus entering, again it is follicles. But if it is some allergen entering the eye, the soldier that conjunctiva sends to fight against the allergen is what? Called as papillae. So remember guys, if anything enters the eye, there will be two reactions sent by the conjunctiva. What are the two reactions? One is the follicle, other is the papillae. Right? Conjunctiva has two reactions for every insult. One is the follicle. What is follicle, guys? Follicles are what? Follicles are collection of lymphocytes. Collection of lymphocytes which are seen in viral chlamydial infection. Collection of lymphocytes which are seen in viral and chlamydial infection. Follicles can't be produced before 2 months of age. Follicles can't be produced before 2 months of age. So second reaction by the conjunctiva is what? Papillae. Right? Papillae. Papillae are nothing but what, guys? Papillae is nothing but elevations which are seen on the conjunctiva, which usually occurs as a response to what reaction? Allergic reaction. Papillae are elevation seen on conjunctiva due to allergic reaction. Due to what reaction? Allergic reaction, or basically due to allergen, guys. It's not allergic reaction, due to allergen. Right? And these are the two reactions. Apart from these two reactions are basically, if anything is entering the eye, these two reactions are being sent. These two soldiers are being sent. When these two soldiers are being sent, these two soldiers try to fight with the thing that is entering the eye. During the fight, there might be some discharge occurring. There might be some discharge coming out of the eye. There are three types of discharge that you can see due to the fight between these two. Remember, guys, what are the discharge that you see over here? The discharge, if it is bacteria that is entering the eye, the discharge that you see is the purulent discharge. If it is the allergen entering the eye, the discharge that you see is called as a mucoid discharge. Right? So purulent discharge is seen, mucoid discharge is seen, and serous discharge is seen. Purulent discharge is seen, pus-like discharge is seen due to bacterial or infectious condition, whereas mucoid discharge is seen if there is an allergic reaction. Whereas serous discharge, watery-like discharge is seen when there is viral infection. So remember, guys, anything that enters the eye, our conjunctiva will have two reactions towards us. One is the follicles, other is the papillae. Follicles and papillae. Follicles are usually sent by the conjunctiva to fight against the bacterial infections, whereas the papillae are usually projections of the conjunctiva sent against the allergen. But as the fight is between the organism and the soldiers of the conjunctiva, there might be discharges seen depending upon the organism. If it is bacterial, you will see purulent discharge. If it is allergic, you will see mucoid discharge. And if it is viral, you will see what discharge, guys? You will see serous discharge. Okay. The thing is, basically, by looking at the discharge also, you can see by looking at the discharge also, you can say what kind of thing has entered the eye. If it is a mucoid discharge, it will stretch. Stretching property of the discharge will help to differentiate the mucoid with the serous discharge. Okay. So mucoid discharge will stretch. Okay.